Have you ever wondered what would happen if you didn't brush your teeth for a year? It's a question that might make you cringe, yet it tickles the curiosity in us all. Imagine the most dramatic consequences your mind can conjure. Do they involve tooth decay, gum disease, or perhaps a social life that takes a nosedive? We're about to delve into a world where oral care is tossed out the window and the results aren't pretty. Well, brace yourself because the effects are more frightening than you might think. Dental hygiene, as mundane as it sounds, plays a crucial role in our overall health. It's more than just a ritual of brushing twice a day or flossing regularly. It's about maintaining the well-being of your oral cavity, which, believe it or not, is a window to your overall health. Let's delve a bit deeper. When we talk about dental hygiene, we are essentially talking about the maintenance of our teeth and gums. Poor dental hygiene can lead to a multitude of oral health problems including cavities, gingivitis, and periodontal disease, commonly known as gum disease. But that's not all. There's a strong body of research that suggests a link between oral health and systemic health. For instance, gum disease has been linked to a host of health complications outside the mouth, from heart disease, diabetes, respiratory disease to certain types of cancer. How does this happen, you ask? Well, the mouth is full of bacteria. While most are harmless, some can be harmful if oral hygiene is not maintained. These harmful bacteria can enter the bloodstream through your gum tissue, potentially affecting other areas of your body. Consider this. According to the American Dental Association, people with gum disease are almost twice as likely to suffer from coronary artery disease. That's a staggering fact, isn't it? And it's not just adults. Even children are not immune. Poor oral health in children can lead to impaired school performance and poor social relationships. So you see, dental hygiene is not just about maintaining that pearly white smile or avoiding bad breath, although those are important too. It's about keeping your whole body healthy. Neglecting it can lead to a chain of health issues that extend far beyond your mouth. Ignoring dental hygiene may not only cost you your smile but also impacts your overall health. So, what exactly happens when you decide to skip brushing your teeth for a whole year? Well, let's embark on this less than pleasant journey starting from day one. The initial consequence is a buildup of plaque. This is a sticky biofilm made up mainly of bacteria. It forms on your teeth when the starches and sugars in food interact with the bacteria normally found in your mouth. Plaque buildup starts almost immediately after you eat and can harden into tartar within 24 to 72 hours. Tartar is more difficult to remove and can lead to more serious problems. After about a week of neglecting your dental hygiene, your breath will start to smell bad, a condition known as halitosis. This is because the bacteria in your mouth, which are now thriving due to lack of cleaning, break down food particles, releasing foul-smelling sulfur compounds. As weeks turn into months, you may start to notice your gums becoming red, swollen, and prone to bleeding. This is a condition known as gingivitis, the earliest stage of gum disease. It's caused by the toxins produced by bacteria in plaque, which irritate the gums. If you don't treat gingivitis, it can advance to periodontitis, a more severe form of gum disease. Periodontitis can lead to the loss of bone and tissue that support your teeth. It's not a pretty picture, is it? By the end of the year, you may notice your teeth becoming loose. This is because the bone and fibers that hold your teeth in place have been severely damaged by the ongoing infection. Let's not forget about cavities. These are holes that form in your teeth as a result of tooth decay. Tooth decay occurs when the bacteria and plaque produce acids that eat away at your tooth enamel. Without daily brushing and flossing to remove plaque, tooth decay can progress rapidly. By the end of a year without brushing, you may find yourself dealing with a host of dental issues, from cavities and gum disease to tooth loss. But the consequences of neglecting dental hygiene go beyond your mouth. Poor oral health has been linked to a number of systemic diseases, including heart disease, diabetes, and respiratory disease. And then there's the financial cost. Treating these dental issues can be expensive. According to the American Dental Association, the average cost of a single dental implant can range from $1,000 to $3,000, and that doesn't include any additional procedures you might need. As you can see, the cost of neglecting your teeth can be quite high, both health-wise and financially. So if you're thinking about skipping that morning or night brush, you might want to reconsider. Now that we know the consequences, let's delve a bit deeper into the science behind dental decay. Our mouths are teeming with hundreds of different types of bacteria. Some are friends, aiding in digestion and protecting our oral health. Others, however, are foes, contributing to dental diseases. The process of tooth decay begins with these bacteria. When we eat, particularly foods high in sugars and starches, these harmful bacteria feast alongside us. They metabolize these sugars and starches, producing acids as a byproduct. This is where the real trouble starts. These acids, combined with the food debris and saliva in our mouth, form a sticky substance known as plaque. Plaque begins to accumulate on and between our teeth, especially if we don't brush and floss regularly. The acids in plaque start to dissolve the minerals in the tooth enamel, the hard, protective outer layer of the tooth. This process is called demineralization. Over time, these acid attacks cause the enamel to lose more minerals than it can replenish, leading to the formation of tiny holes or cavities. If left untreated, the decay can progress deeper into the tooth, affecting the dentin and the pulp, causing toothache, infection, and eventually tooth loss. Now let's talk about acidic food and drinks for a moment. Acidic food and drinks like citrus fruits, soda, and wine can lower the pH level in the mouth, making the environment more conducive for the acid-producing bacteria to thrive. They can also contribute directly to enamel erosion. Another important factor to consider is time. Each time we eat or drink, the acid attack can last up to 20 minutes. So, frequent snacking or sipping on sugary drinks can lead to continuous acid attacks on our teeth. Understanding the science behind tooth decay can help us appreciate the importance of maintaining good oral hygiene. While the consequences of poor dental hygiene are scary, the good news is that it's preventable. Prevention, indeed, is the key to maintaining a healthy and happy smile. This is where the power of everyday rituals come into play. Brushing, flossing, and routine dental checkups are the trifecta of oral health. Let's start with brushing. This should be your twice-daily ritual. It's like your morning coffee or your evening wind-down routine. Brushing twice a day, every day, helps to scrub away the plaque that builds up on your teeth, preventing it from hardening into tartar. It also helps to keep your gums healthy, reducing the risk of gum disease. But brushing can't do it all. This is where flossing steps in. Flossing reaches those hard-to-get spots between your teeth, removing food particles and bacteria that your toothbrush can't reach. It's like the secret weapon in your oral health arsenal, helping to prevent tooth decay and gum disease. Now, even with diligent brushing and flossing, it's still essential to visit your dentist regularly. Dental checkups are like your car's MOT. They are designed to catch any potential issues early before they become bigger, more painful, and more expensive problems. Your dentist can spot signs of decay, gum disease, and even oral cancer that you might not notice until it's too late. And don't forget about diet. What you eat and drink can have a significant impact on your oral health. Foods high in sugar can lead to tooth decay, while acidic foods and drinks can erode your tooth enamel. So make sure to balance your diet with plenty of fruits, vegetables, and water. So there you have it. A few simple steps can make a world of difference when it comes to your oral health. Brush twice a day, floss daily, get regular dental checkups, and eat a balanced diet. It's not rocket science, but it's a ritual that could save your smile. Remember, your teeth are meant to last a lifetime. It's up to you to ensure that they do. To recap, neglecting dental hygiene can lead to serious health issues. We've journeyed through the importance of dental hygiene, the consequences of neglect, and the science behind tooth decay. Remember, prevention is always better than cure. Consistent brushing and flossing can save you from painful and costly dental procedures. The stakes are high. It's not just about your smile, but your overall health. So the next time you think about skipping brushing your teeth, remember the consequences and make the right choice for your health.